alcoholic liver disease, alcoholic heart disease, alcoholic brain disease. So we consume more poisons. That's a problem. So DXN, if you are in DXN, you should not indulge in smoking or drinking because you are cheating yourself. The health is something that's very, very precious. So when it comes to a question of cancer, it's alarming. Young people are getting into, the disease. And many of the cancers, the drugs may not act, or they come in the late stages of the illness where we are not able to do anything. So cancer screening is very important. And pick cancer patients, diagnose cancer patients at a very early age, very early stage, so that they can be effectively treated. Right? It's going to be alarming in the coming years because the cancer, my feeling is cancer may overtake heart disease in another 20 to 30 years. So we have to be prepared for that. And especially women. Cervical cancer and breast cancers. So this cancer screening is absolutely important. So Ganoderma, what it can do is, it can prevent cancer. It's so powerful that it can protect you. And also it can help in the treatment. And another medicinal benefit is anti-allergic effect. We become allergic to so many things because we use a lot of chemicals day to day, especially in the form of perfumes, lotions, creams, hair dyes. You never know to which product you will become allergic to. Especially, the hair dye is notorious. And there is a particular component, PPD, polyphenol diamine, which can cause cancer. It can affect your vision. It's deadly to heart and the kidneys. So those who are using hair dye, be careful. So it can get absorbed in your system, and ultimately after 5 years or 10 years or 15 years, it can harm you. Having a black hair is not healthy. It doesn't, improve your health. Rather, we are wasting our time, doing all those, things. And now there are a lot of colors also, red, yellow, and the hair sticking out. Lucky that I don't have hair, no problem. Hair doesn't have any function, right? So don't, if you are concerned about your health, stop using all those deadly chemicals. And they can produce allergy, which can lead to very many diseases. Allergic disorders of the eye, brain, heart, kidney. Ganoderma is a very powerful anti-allergic agent. Many components in Ganoderma can act as anti-allergic agent. Lanostan, linseed, cyclooctasulfur. So very powerful, for skin allergy, for bronchial allergy. Ranganathan will be sharing about, the asthmatics and nasal allergy patients being helped by, Ganoderma. Because allergy is something, it's the antigen, antibody mediated. Once you get the allergy, it's lifelong. Very difficult to control or eradicate. So Dr. Ranganathan has been using this Ganoderma for a lot of his patients with allergy, especially bronchial allergy and nasal allergy. And even eczema is a form of allergy. So those patients can be helped, patients with allergy. So it's one of the important medicinal benefit of Ganoderma. And talking about cancer, Ganoderma can act in multiple ways to kill the cancer cells. One, directly it can kill the cancer cells by acting on the immune system, because our immune system has the ability to identify abnormal cells, including cancer cells. So when you have a good immunity, the immune system will kill the cancer cells. And Ganoderma by acting on the immunity, it can do that and activate the natural killer cells, NK cells. There are another group of cells which can kill the abnormal cells and the cancer cells. They are called as natural killer cells, NK cells. So Ganoderma is able to potentiate those natural killer cells. And another important way by which Ganoderma can kill the as an anti-cancer, by cutting off the blood supply to the heart. So any tissue needs blood supply to grow. And Ganoderma, by cutting off the blood supply to the tumor, that particular growth happening there, it can kill the cancer. So in multiple ways, Ganoderma can kill the cancer cells. And as far as the cardiology is concerned, heart is concerned, it can reduce the blood pressure. Today, the ideal blood pressure is 120 by 80. So someone was talking about how many goals he scored yesterday. I said that numbers in your system is very important. You should know the blood pressure numbers. You should know your blood sugar numbers. You should know your cholesterol numbers. You should know your weight, body weight numbers. And also the your BMI, body mass index. Keep it less than 25. Right? So ideal to keep it below 25. And the number in blood pressure is less than 120/80. That's ideal blood pressure. Acceptable 140/80. Diabetic means 130/80. That's the present value. If your blood pressure is high, it will kill you early. A lot of people, they don't check their blood pressure. How many of you know your blood pressures? Can you raise your hand? Very few. Hardly 1, 2, 3, 4. How many? Less than 10. You are more than 150, 200 people here. Only 10 people know your blood pressure readings. That's very bad. Right? Check your blood pressure. Today, all the digital, the blood pressure meters are available. Am I right? Is it available or not available? It's available. You can check. Very important, because now we talk about high blood pressure in children at the age of 3 years. So today the recommendation is, when a child goes to a doctor, a pediatrician, after the age of 3, check the blood pressure. Because today children, they indulge in taking a lot of salty food, high cholesterol food, become obese. The blood pressure goes up. The blood pressure is high for their age. So these are the children who go on to develop sustained blood pressure and get into heart disease, stroke, or kidney failure and die below the age of 30. We don't want our children to die below 30 years. Right? So it's very important. You should know your blood pressure. At least once in 3 months, get your blood pressure checked, because blood pressure is a major killer. I normally say, having diabetes is not a big problem, because diabetes will kill you only after 40 years or 50 years. Whereas if you have a high blood pressure, it can kill you. Uncontrolled blood pressure can kill you in 5 years. Just 5 years. So if you are 30, 35, you become a hypertensive, you don't control it, the chances are that, you can get killed because of heart disease or stroke at the age of 40, 45. If you become a diabetic at the age of 30, 35, when is it going to kill you? After 30 years, 40 years. So 30 plus another 30 years, 35, 65, 70. But we are worried about diabetes, because it is about your eating habits, and a lot of people like sweets, chocolates, and other sweet things in life. So they are denied of that. And so we are worried about diabetes, not about blood pressure. Today, WHO is strong warning is that, check your blood pressure. Is it difficult to check your blood pressure? Go to a doctor, he will give all the parameters. So my recommendation is once in 3 months, get your blood pressure checked. Blood sugar, maybe once in a year. If you are a diabetic, if you become a diabetic, check your blood pressure once in 3 months, and also the 3 months average blood glucose, HbA1c. But blood pressure, you have to check very frequently, because any point of time one can become a diabetic, especially when you are in a stressful situation, when you are working abroad, the stress of work is very high. So, blood pressure is very, very critical in maintaining our health. So, have an ideal blood pressure. And Ganoderma, by having this ACE inhibiting effect, angiotensin converting enzyme inhibiting effect, it can reduce the blood pressure, and also it helps the heart to pump effectively. It is helpful in heart failure. I will give my own personal experience. I've been taking Ganoderma for more than 14 years now. 14 years. My diastolic used to be around 95, 100, and I started taking medications because a lot of stress and a lot of work, and after the age of 45, 50, your blood pressure starts going up. And I was on 2 drugs. One is nebivolol, another is telmisartan. I was on 40 milligram of telmisartan and nebivolol 5 milligram. Combination which can control the blood pressure effectively. Of late, for the past 2 to 3 years, what has happened is my diastolic has come 74, 76, it never crossed 76. I have withdrawn telmisartan. Today I am only on nebivolol. So have a diastolic pressure low. My systolic will not cross 125, 128, 130. This is out of my experience, consuming Ganoderma for the past 14 years. So, it's very important that, you should control your blood pressure. And also, Dr. Ethirajan, recently, last year he was here, and he is on Ganoderma for a long time, and his blood pressure also, he is 2 years senior to me, Dr. Sivan's classmate. Dr. Sivan is 2 years senior to me in the medical college. He is on Ganoderma. Only now he has started increasing the Ganoderma, and his diastolic around 70, 74. So it's all out of our personal experience. Why should we consume Ganoderma? Being an allopathic doctor, we know that Ganoderma is very powerful, it's good for health. So inshallah, I would like to live for another 10 years. I don't know whether I will live for 10 years, that he has to decide. A lot of my classmates, my colleagues, they are all bypass, stenting. But still, I'm not without. The day will come, I don't know when. But the aging process will catch up. Why do you want to have all those things at the age of 30, 35, and 40? The youngest person I have seen with a heart disease, with a heart attacks at the age of 17, 17, triple vessel disease, heart attack. He started smoking at the age of 10 years. The present scenario is, parents give a lot of money to their children. The money is used for what? Buying pizza, burger, chocolates, ice creams, and also cigarettes, liquor, and also ganja. That's the present situation. When I was in school or medical college, I never get any pocket money. So be careful about giving money to your children, they may misuse it, right? So, my own personal experience is that with Ganoderma, my blood pressure has come down. And I have withdrawn a drug. Why should I take a poison? Why should I take a telmisartan, a poison? Not necessary. So, that is the effect that's why the Ganoderma is now today mentioned in the textbook of cardiology. There's a separate chapter on Braunwald's textbook of cardiology, madam, today, page 1044, about Ganoderma lucidum. I was stunned when I saw that. I showed it to my friends. But we cardiologists will refuse to believe that, right? Still continue to smoke and drink, and the doctors are the first one to get all problems, right? They think that advice is only for others, not for them. But being in DXN, I thought, okay, my health is very important, and I'm least bothered about anybody's health. I'm bothered about my health. So I should live healthy. So Ganoderma is very powerful for the heart. It's a powerful heart tonic. It reduces the cholesterol. And cholesterol numbers, it should be 150 milligrams. Check your cholesterol maybe once a year. So if cholesterol is high, take the advice of the doctors and start taking statins, right? And it's a very powerful herb for the brain. It can improve the memory. It can make you brisk and active. Sleep function, it can modulate. And spiritual potency, it can increase the spiritual potency, because by having a calm mind, Ganoderma can increase the spiritual mind. Only if the mind is calm, the spirituality you can develop. Otherwise, it's not. That's why the Buddhist monks, right from 5,000 years, they have been consuming Ganoderma. Even today, they are consuming Ganoderma. Such a powerful herb which acts on the brain, and many of the brain disorders can be helped. Neuropathies can be helped, like Alzheimer's, Parkinson's, I mentioned about that. And blood sugar, for diabetic patients, Ganoderma can help in reducing the blood sugar, because contains Ganoderma A, B, and C, which will reduce the blood sugar. Help in a lot of complications due to diabetes, like non-healing ulcers, neuropathies. My mother is on Ganoderma. She's 81, and I put her on Ganoderma for diabetic neuropathy. Very distressing complication. No drugs, effective drugs for neuropathy. So non-healing ulcers, beautifully they can heal. So diabetics are prone for such complications, and apart from controlling the blood sugar, it can help in these situations. And it's a very powerful liver tonic, heart tonic, brain tonic, and protect the vital organs. And detoxification we talked about. That is a unique function of Ganoderma. When you eliminate the toxin, your health is protected. And especially by acting on the hormone levels, it can help a lot of women to help in infertility, because women's health is very important. And Dr. Asma Munir will discuss upon it today, because the WHO focuses on women's health. And if you go to the website, they go to the extent of saying that, today's scenario is that we are misusing women. So any crime against women, not tolerated. We are misusing women. In what sense? All the advertisements, everything, we use only women. It's very bad, right? So women's health is very, very important. Only the mother can give health to the entire family. So mother should be healthy. So a healthy mother, healthy child. Otherwise, much of the mother is not healthy, many diseases can be caused during when the child, baby grows in the womb. The major problem is there. So that is why today we focus on young girls to have better nutrition, better, the health conditions, so that, they can only produce future generations, good generation, healthy generations, not men. One of my classmates, Dr. Geeta, she's a very famous gynecologist and obstetrician, my classmate. She wrote a book, and we went for the book release. And she said, the women, they produce one precious, the ovum, egg, every month, where men, we produce millions and millions of sperms, and you fellows, you are only sperm donors. Very important that we should remember that women's health is absolutely important. So, the present point of time, the focus is only on that, women's health. So, Ganoderma, by balancing hormonal levels, it can help in infertility. And regeneration function is the ultimate function of Ganoderma, because Ganoderma can help the regeneration of cells in the old age. The old age, aging process sets in because of decreased blood flow. As your blood flow comes down from head to foot, all your functions come down. Your memory comes down, brain function comes down, your vision comes down, digestion comes down. So keep your blood flow normally. And Ganoderma can do that. And second, why the aging process happens is that, we lose a lot of cells from the body. So we should have the power of regeneration of the cells. Ganoderma can stimulate that. Another important change which happens in the old age is that your mitochondrial energy production comes down in the age. And Ganoderma is something like, it can recharge your mitochondria. That's why people taking Ganoderma, they feel very brisk and active, because it's charging your every cell in the body by acting on the mitochondria. Right? When you don't charge your cell phone, what happens? It crashes. You have to recharge. Like that, you have to recharge your body day in and day out with good nutrition, good food. And when you take Ganoderma, it can recharge your mitochondria. Right? So that's very important in the old age. So regeneration function helps you to keep up your health in the old age. It's a very powerful adaptogen. Adaptogen meaning that it is absolutely non-toxic. Any amount you can take. Spirulina is an adaptogen, Moringa is an adaptogen, and Ganoderma is the king of adaptogens. So number one. And it's an anti-stress herb. It can address many forms of stress. And I already mentioned that Ganoderma today is mentioned in the textbook of cardiology. Eugene Braunwald. Eugene Braunwald is living now still. He's 87. He is in Emory School of Medicine, and he is called as a father of modern cardiology. And in the 9th edition of Braunwald, there is a mention about Ganoderma lucidum. I have talked to many of my colleagues, but they are blind about it. They won't take. So for the heart, it's a very powerful heart tonic. How much Ganoderma to take? Here it is available in the form of a powder. Start with the quarter measure, increase it to 1 measure or 1 or 2 measures a day over a period of time. And in cancer, high dose has to be given, because high concentration of Ganoderma can only kill the cancer cells, because cancer cells are resistant to many drugs, or they require a high level of concentration of drugs or Ganoderma to get them killed. So food is an important part today to stay healthy. And if you want to be healthy, you have to take the right diet. And especially since, Ramadan is starting, it's very important that you should take care of the nutrition, because whole day you fast, your body requires nutrition during the daytime. And in our Hindu custom also, we have practiced, the fasting, and from sunrise to sunset on certain occasions. But you have to fast almost a month, right? That's very difficult. And your body will crave for nutrition. Your body will crave for energy. So Ganoderma, the DXN products, especially Spirulina and Ganoderma, can give you all the nutrition and energy what your body requires. So my thinking is that, if you are fasting on Ramadan, early morning, when you start your fasting, before starting, consume adequate amount of Ganoderma and Spirulina and other supplements. And when you are breaking a fast, after the sunset, you load your system with Ganoderma. Don't neglect your nutrition. That is my strong recommendation. So we have very powerful products in Ganoderma which can give you enough nutrition and energy for you to work in the daytime. Of course, we have to work, right? We can't go out, take off from our work if you are fasting during the Ramadan. So my advice is, load your body with good nutrition, DXN supplements. So you have a lot of information on Ganoderma and all these websites, especially, the PubMed. You have all the research. So I'm not able, for want of time, I can't give you the research information. There is a lot of information. Just go to the website. When any article gets published in PubMed, that means it's a highly, scrutinized article, and it's published in the scientific journal. And there is another website also, at Sivan will tell, where you can get a lot of information about the many scientific articles on Ganoderma and other products. So Ganoderma is the king of herbs, and take Ganoderma for health. And the focus is health, prevention. Don't think doctors can cure all diseases, can give back health. Doctor can only treat the disease. They can't give back health to you. So just, one measure of Ganoderma a day, you can keep the doctor away. Don't go to a doctor. Because doctors are bad fellows, right? Especially cardiologists. They will say, undergo angiogram, let me do an angioplasty, stenting, and surgery. So even today, some of my patients at the age of 70 and 80, they come to me and say, Doctor, I have not been to a hospital. I have not taken medications. I feel so happy. But what is happening is today is a lot of youngsters at the age of 20, 25, 30, they come with high blood pressure, heart disease. It's a very sad state of affairs. So as many of you are working here, expats, your health is very, very important. Your family is concerned about your health. Please take care of your health. And you have powerful nutritional supplements in DXN. And after having all those informations, a wise man should apply those information, scientific information. As Swami Vivekananda said, wisdom lies not in the amount of knowledge acquired, but only in the degree of application. Use the information, use the knowledge. Once you are confident, you are sure that Ganoderma is good to you, you take it. Don't just see and keep it in the cupboard. A lot of people do that. Oh, I bought, Ganoderma powder, it's all lying there. Under the cot or, somewhere in the shelf. You must use it to get the benefit, right? And whichever profession that you are, you should work hard. As Thomas Alva Edison puts it, great scientist. 1%, a genius is one with 1% inspiration and 99% perspiration. Work hard. And we have all come here to work hard so that your family is better off. Your children are better off. You want your children to be educated better. You always say, as a father, give them good education, one eye. Give them also good health. Mother can give good health. That's one eye.